Hello, my name is Erica Harper, and this is my media clip project for TESP 302, Educating Exceptional Students. Today we're going to discuss the exceptionalities within the classroom and the principles of universal design for learning and differentiated instruction. According to our text, the principles of universal design for learning are basically modifications to how curriculum is presented or represented, or to ways in which students respond to the curriculum, such as engagement, representation, action, and expression. Differentiated instruction is to ensure that students' learning strengths and needs are addressed, and that's basically modifying our instruction, providing a complex variety of content and the methods in which we approach or teach it to our students. We'll start with learning disabilities, which have attributes in the social, cognitive, and academic areas. They're going to deal with depression and anxiety because there's that deficiency in social skills. It's difficult for them in understanding or using language. They are above average or at the average intelligence, but they have challenges that consist of learning and processing new information or memory. This is typically in your math and reading areas, such as dyslexia. Ways in which we can approach this is by providing pre-tests, exams that introduce the information to them, response to intervention approaches, receiving instruction at the tier 2 or 3 level, organizational skills, color coding, all of which can help students in this area. Speech and language disorders are going to consist of interaction with and understanding other students. It can be difficult to express feelings. Include speech impairments, articulation of speech sounds, fluency. Language impairments may be receiving that information or understanding it. So those are all areas that you want to focus on, especially in their academic area. They may be using improper use of words or word meanings. Ways to assist students in this area is to present information in a manner that assists comprehension. You don't always have to have a written method for assessment. So utilize a variety of assessments to see what the student really understands and knows. Graphic organizers, storyboards, even communication devices can aid you in facilitating students in this area. Emotional and behavioral disorders, they're going to have inability to build or maintain relationships with peers and teachers. They show signs of being unhappy or depressed, which if you don't have a relationship, that can be a challenge. Cognitively, they have the inability to learn, which is unrelated to intellectual, sensory, or health factors. They have a tendency to develop physical symptoms or fears, which when you're not a part of something and you don't feel like you're a part of something, that's going to affect not just social, but cognitive as well. And your academic areas. They typically have normal intelligence, but significant challenges related to emotional, behavioral, and academic skills. Areas in which you can work on this would be reducing the overstimulation within the room, providing opportunities for comprehension, understanding, meditating, problem solving, dealing with emotions, labeling emotions, and knowing how to address those different factors. Attention deficit hyperactivity disorder is also known as ADHD, and there's 3 characteristics here: impulsivity, hyperactivity, and inattention. You're going to have your excessive talking, your distractions, your careless mistakes, interruptions, difficulty focusing, and a lot of this can contribute to just classroom management, finding ways in which you can alleviate the distractions in the room, providing organizers for the students, schedules, chunking so that they're not overwhelmed, ways to track their progress, sensory stimulus that they can utilize so that it helps to gain their attention during an activity, all of which can be utilized in the classroom. And support across all 3 tiers, of course, and as well as teaching self-regulation. That's a huge thing when you're dealing with ADHD. Intellectual disability, you're going to have behind others socially. It's unfortunately a factor there, and it's going to make it hard for them, as well as planning, problem solving, and comprehending are going to be an issue in that area. Significant limitations in intellectual functioning and adaptive behavior, short-term, long-term memory, working memory, all are going to be impacted by intellectual disabilities. And unfortunately, almost half of the students that have intellectual disabilities spend less than 40% of their time in the classroom. So ways that we can kind of increase that and improve that number is by utilizing embedded instruction to provide instruction in naturally occurring situations, teaching those life skills. It's going to be a huge improvement and impact for that student, and providing support, encouragement, things that are going to give them something to achieve. Setting a goal would be a huge accomplishment that a student could work towards. Moving on to autism, which is a huge spectrum. You could be on the one end, which is, gifted and talented, or you can be on the other end, which is a nonverbal student. With nonverbal students, you're going to deal with communication issues, which can have behavioral issues. A big thing to utilize in this area would be things such as social stories, so that they understand what is being taught and expected. You can also, for children in the autism spectrum, provide checklists or schedules so that they have a way to track and kind of self-monitor what they need to accomplish. Multiple disabilities and traumatic brain injury, they're going to have trouble relating to others, and there's anxiety, depression, frustration. All of this comes from this disability. Many individuals with multiple disabilities actually have intellectual functioning disabilities as well, or impairments to that. Coordination problems, physical weakness, and fatigue all can be challenges of an individual with either one of these. And honestly, it comes back to just assessing your students, seeing what their needs are, and utilizing your paraprofessionals in the classroom. Don't over-utilize them. Utilize them, provide them support so that they can be an assistant to you and to the student as well. Physical disabilities and other health impairments, you're basically looking at the things that are limiting mobility here, like asthma, epilepsy, spina bifida, cerebral palsy. All of those can cause social issues of isolation, but cognitive issues as well, needing more time, which can be an asset if you provide that to them. That may be all they need to show what they understand and comprehend, They do spend the majority of their time in the classroom. However, some spend their time in a hospital or at home. But there are ways to incorporate them. Cooperative learning strategies, accommodations, modifications to the classroom, especially the environment. Hearing impairments, you really come down to the factor here of what are their limitations. Are they able to do sign language? Do they have an interpreter? Do they have technology devices? Are they able to communicate? Did they lose that or have that significant language lost during a critical time period when they were learning language? So it's really going to be you monitoring their literacy development, understanding where they are academically. Provide those accommodations, whether it be an interpreter or technology, and strategies to involve intensive early intervention. With visual impairments, it's going to be a lot like the hearing impairments. You need to assess the factors that contribute to that. And so what range are they limited to? Some are gifted or have special talents. A large number have multiple disabilities, but they all have a limited ability to learn incidentally from the environment. So as a teacher, you need to provide those opportunities to those students and the accommodations they need. For gifted and talented, this is actually not a category under IDEA. However, it is a category that you need to address because surprisingly, students feel anxiety, stress, the need to be perfectionism, peer issues in regards to not understanding where they fit in because they do feel like they are different. So, providing opportunities for them to excel, giving them opportunities to extend the curriculum and going after things they have an interest in. As well as focusing on autonomous learner model, which highlights self-awareness and development of talents. IDEA's principle: equal opportunity, full participation, independent living, economic self-sufficiency. These are all part of what a classroom should be and what you want to make your room successful. Thank you.